First of all, I think it's important to remember that options matter for patients. So in myelofibrosis and MPNs more broadly, these are chronic diseases, and patients are living for decades in relatively stable health. But knowing that there are options over time if something either stops working or their disease progresses, knowing that they can sequence through a few more options and maybe even some newer combinations that are interesting brings a lot of hope and promise for patients, gives them some comfort as they navigate their journey through their disease.
Couldn't agree more. Yeah, I mean, I think the key to treating myelofibrosis in particular is you really need options to tailor the therapy. So it's not really one treatment fits all. So whether it's a monotherapy, a combination, or when to switch and which agent to pick really is individualized for the patient. So the more options we have as physicians, the more likely we can tailor and optimize the treatment for an individual.
Yep, that's our motto. Options matter. And even adding to the symptoms themselves, we at MPN Research Foundation have recently done a study of surveyed some of our patients. 676 patients responded and came back and said what their goals for treatment are, and it is improved quality of life. 50% said improved quality of life, and more specifically, 40% said relief from symptoms. Is their primary goal for treatment. And so I think these options that are coming online, the combinations and the ways in which we're looking at how symptoms are being measured and managed, I think is very important to patients.
Absolutely. And symptoms are complex, and then you and I have had this conversation before. Yeah. Sometimes it's hard to measure symptoms. It's hard to measure the actual benefit or absolute benefit of a given therapy or combinations with symptoms. So it's definitely been an area in our field for drug development where we're trying to figure out what is the best way to capture that benefit for any individual patient, because some patients may benefit to greater degrees than other patients, and not all therapies are ideal for any given patient. So it really is a complex world that we're living in terms of trying to actually navigate this. But clearly patients are symptomatic. They want to feel better. Physicians want to make patients feel better, but we also want to extend survival with good symptomatology. So it's sort of a mixed picture. And for some patients, the symptoms may be systemic symptoms, cytokine-driven symptoms. For other patients, it may be more spleen-related symptoms. So, even the symptoms part is complex because it could be different symptoms driving for any individual patient. And how best to measure that is really, I think, an interesting topic that's evolved over time. And years ago, we were really sort of binary, whether you had a 50% reduction or not. I think now we're sort of moving into an area where we're looking at absolute changes in symptoms, and that might be a better way of actually gauging symptom benefit. And it's always not always, but it's often in the context of how much spleen we've reduced, and then looking more broadly at other biomarkers, trying to get a sense, are we really changing fundamental aspects of the disease? But as you and I and others have had discussions, at the end of the day, we're really hoping that we're not just improving symptoms here, today and tomorrow, but also down the line that we're changing the disease course to extend outcomes and improve survival.